I'm Joan Davis, President and CEO of the Richmond Community Foundation, and I welcome you to the first event of our 2011 Northern California Summit on Children and Youth.
Trying to think of a new way to approach community revitalization and how we all work together. Actually, what's been going on here in the West County is probably a model for what that change is going to look like, and it's been going on for a long, long time.
Said it, but there was a physician that said, if I could write a prescription for anything, it would be for affordable housing, because that is so important to the impact or to the future of the people that he serves.
When we first started there, you know, nobody really wanted to come in. And then after we started building, they started to see that there was a plan for improvement. You know, people started to buy into the notion. The Healthy Richmond is a good example. They mobilized the whole community. They got all different facets of what was going on and came together on a plan to address it in a systematic way, a measurable way. And it's just getting started. I think it's going to be really effective.
School children, the majority of school children in West Contra Costa County are overweight and obese, from 36 to 60+%, depending upon the school here, are overweight and obese. It is the highest concentration of overweight and obese children in the county. You get changes like that only because of changes in the environment. And this is such a significant change that we are looking for the first time at a generation whose life expectancy will be less than our own if things don't happen. That's how profound this epidemic of obesity is. Never happened before in the United States. In Richmond High, we took some of the youth there and we armed them with a video camera and we set them out on a quest to see if they could buy an apple. They couldn't.
There's food deserts, places where people do not have access to good quality food, and putting grocery stores in makes good sense. But my question to them at the time was, well, what has the impact of putting the grocery stores had on the community where you put them? And they said they didn't know. In fact, they told me it was impossible to know. You can't measure the impact of putting a grocery store in. It's too complicated. I mean, if you can have good preschools, good schools all the way through, get kids actually graduating from high school with knowledge, not just getting a degree, that has a greater impact on health than anything else. And I actually think we're blowing it right now on a national level, focusing on health care and access to care, when in fact we need to be encouraging more money being spent in education rather than trying to lay off teachers and stuff. Those who had used the train line once a week had lost 8 pounds in 10 months after the train had opened, as opposed to those who were not using the train. And they were able to show that it was the walking to the train and to work at the other end that made the difference.
You know, Chevron's been a big investor in this community. We've been part of this community for over 100 years. And last year we invested over $3.7 million in helping make this community a thriving, healthy, and safe community.
What you're going to do is to go back to your various agencies and be the advocates for the people who have no voice.
As Charles Simmons said, Charles Simmons was a British gymnast in the early 20th century. He said, "Sickness is the vengeance of nature for the violation of her laws." That is why we in Richmond put so much focus on the green, clean, healthy future of the 21st century. That's why we have a great environmental initiatives team in the city of Richmond. That's why my office places such an importance on having a clean, healthy environment. That is why we have a health and wellness element in our general plan, one of the few cities that has this.
The United Nations Convention on the Rights of the Child recognizes the right of the child, quote, to engage in play and recreational activities appropriate to the age of the child. Significantly, the United States is the only country in the world that has not ratified that convention.
We know that coverage is not necessarily access. So that's going to have to be kept in mind. I mean, look at California. You have 2/3 of children eligible but not enrolled in public programs. 2/3 of those eligible but not enrolled are Latino.
Dr. Frieden at the CDC says there are no magic bullets around obesity, but if there is one kind of most significant thing, it would be around sugar-sweetened beverages from an obesity prevention standpoint. I know that's a very difficult, controversial thing, but UCLA and UC Berkeley came out with a couple of studies that show that 43% of the increase in calories since the 1970s has been in the form of sugar-sweetened beverages.
It's a great opportunity for us in Richmond to take a leadership role, to say, well, you know, not everybody's figured out how to do this yet, but let's figure out how to make this a healthy community. Let's figure out how to build our local resilient economy that we need to do. I think the spirit of service probably motivates all of us in this room, and I was looking to Dr. King, and Dr. King equates the spirit of service with greatness, that everybody can be great because everybody can serve. And I think you've been such a great model with your life dedicated to service. And Dr. King said that what you need to serve is a heart full of grace and a soul generated by love. So I'm sure that you've got that, Dr. Ross, and I'm sure you're going to inspire us all in that direction. So it's a real honor for me to welcome you to Richmond and to welcome you to the stage.
We are focusing on, in particular, on 14 communities across the state. Richmond, Sacramento, South Sacramento, and Salinas are 3 of the 14. And that we needed to make some tough decisions about focusing on a limited number of communities and stick with those communities and leaders in those communities like you all in this room for a decade on behalf of young people. Okay? The scientific research, public health data, and evidence tell us that place is really important in health. If you want to determine statistically what your life expectancy is going to be in this country, tell me your zip code, and I'll tell you what your life expectancy will be. In this country, of the $1.8 trillion that will be spent in health care this year, less than 3 cents on every dollar will be spent on prevention. Although if you look at the leading causes, and Dr. Ritterman knows this from his work as a cardiologist, the leading causes of disease and disability and morbidity and mortality and death in this country, the top 10 leading causes of the top 10, 9 are prevention and lifestyle conditions in some manner, way, shape, or form. The solution to creativity doesn't come from Washington or Sacramento or the Ivy League, hollowed halls of universities. It comes from the neighborhood and from the streets. We don't have a data problem, we don't have a research problem, we don't have an innovation problem, we have a power problem. You know, when I heard about zero tolerance in schools, I thought that was a good thing. But what we're hearing is, well, you know what? It's well intended, but it's having a harmful and bad effect on kids because they're getting pushed out of school.
There's nothing more rewarding to an event presenter than to hear the buzz going on when you come out of your workshops. That is very refreshing. And the comments I'm hearing, I think we need to give a round of applause to all of the workshop presenters from this morning.
Well, one of the things that we're going to be talking about on this panel today is the need for play at all stages of life. And some of the most exciting things in this field are happening right here in East Bay, and in particular right here in the city of Richmond. Play can actually refer to all kinds of activities. First of all, we're not talking about playing video games. The kind of play that is most directly connected to children's development is the kind that comes from their own intrinsic internal desire to play, to make sense of the world around them. And that means that it's not organized and directed by adults.
At the same time, adults have a critically important role in making sure that children have an opportunity to engage in that kind of play.
The odds that a black child or youth will have someone close to them murdered is 8 times for a white child as compared to a white child, and for a Latino child, it's 7 times higher. But it's this stat that's shocking. The odds that a black child or youth will witness a murder is 20 times that for a white or Latino child. Witnessing murder.
So we learned a lot about providing family planning services and what we could do to really impact the teens that we were working with and helping to promote thinking about pregnancy before they get pregnant.
You can change a lot of people's health by changing policy.
Absolutely.
You know, I think it's very easy to feel like, to some extent, this is not easy and it's hopeless. But, you know, I think if we look through public health history, there are a lot of examples of success. Child safety belts, smoking prevention, minimum drinking age, immunizations, helmet laws, lead levels. And so I want to talk a little bit about these sorts of experiences, some of the common threads are, and then talk as a group about what some of the implications are for the work that all of us are doing. And you can put a lot of effort into trying to change people's behavior, change how they approach their lives, their choices, but if every other message around them is saying something else, it's very hard to create that change.
And we found that when we could all put our heads together and be connected, we did a whole lot better than people working in isolation. So when I say the word social network, let me first say, what comes to mind?
Facebook.
Exactly. I knew somebody was going to say it. What else? What else comes to mind? We're always connected with each other. We have bonds of trust, empathy, mutual accountability, mutual dependency. That's what we mean when we talk about social networks. But we think everyone has something to contribute to and something to gain from closer social ties and shared prosperity.
That's why I teach at the jail.
See, exactly. That's reconnecting people. I mean, that idea of...
No, reconnecting me.
And reconnecting me.
Again, I want to thank our sponsors, our presenting sponsor, Chevron. Thank you so much. PG&E, Kaiser, Cal Endowment, First 5 Contra Costa, LISC, Mechanics Bank, Genzer & Watson, 23rd Street Merchants Association, Eric Zell, the Glenn Price Group, the National Park Service. Thank you all for supporting us.